Hello everyone, it's Mo at Pareto here, and today we're going to be going over chest x-rays. Now, chest x-rays are important not only for your written exams, but also for your OSCEs, because you'll be asked to look at a chest x-ray, interpret it and present your findings to an examiner. So it's important and it's worth knowing some of these common x-rays. We're going to start off with consolidation. Consolidation is probably a fan favourite from examiners and also clinical practice. You'll see it so many times. And consolidation is as a result of fluid that occupies part of the lung parenchyma, hence why it produces this fluffy-like picture. And it can be anywhere really. So here it's in the right lower lobe, here it's in the left lower lobe, and here it's in the right middle lobe. And it could be fluid, it could be blood, and this is where it becomes significant because consolidation by itself doesn't necessarily tell you what's causing it. So you need to find the cause. And hopefully you can start to put two and two together with the clinical picture in order to conclude what it's as a result of. So maybe a lower respiratory tract infection. There is one exception, however, and this is what I want you guys to focus on. TB. Now, consolidation in the right upper zone or even the left upper zone, that looks consolidative, but also looks quite circular, or what we call CAVitating, is almost certainly TB. So if you get a vague clinical picture of someone who's travelled as an example and an x-ray that looks like this, probably 99% certain it's going to be TB, and you shouldn't really go for any other answer, and that's significant for your exams. The next x-ray I wanted to show you guys is heart failure, a common fan favourite once again. Now, often you're going to be shown an image with about 5 changes that occur in an x-ray in patients with heart failure. And it's very rare that all 5 of those changes occur simultaneously. So we're going to focus on the high yielding, most important ones. So for instance, in this x-ray, you will find some costophrenic blunting. So this is some fluid or pleural effusion, just blunting the costophrenic angles bilaterally, more pronounced on the right than the left, of course. You also get this alveolar edema, where you get this bat wing-like appearance, and that just shows the increased amount of congestion around the hilar region, in particular within the alveoli. You also get other changes such as curly bee lines, but these are very, very rare and difficult to spot as well. So costophrenic angle blunting and also alveolar edema is probably the most important things that you need to look for in a heart failure x-ray. Finally, pneumothorax. Now it will be a simple pneumothorax that you'll get, not a tension pneumothorax, because if you think about it, they shouldn't really be having an x-ray if you think that they've got a tension pneumothorax. So pneumothoraces are common, spontaneous or even secondary to other respiratory diseases or even trauma. And they're characterized by this change in almost texture between this portion of the lung and this portion of the lung. So you can see here the prominent lung markings, which are completely normal if you compare it to the other side, but you see the absence of the lung marking all the way on this side of this left lung. And if you look carefully enough, you can see the edge of the actual lung. So I'm just marking it here, and hopefully that's clear enough for you, of the actual lung. And that's where the pneumothorax is. And that's it. Those are some common x-rays that you need to know. I hope that's been useful for you. And you need to look at as many as you can in order to really master x-rays. And that's it. So hopefully see you again. See ya.